What happens after you complete substance abuse treatment? If you're wondering what you or a loved one should do next, then you're in the right place. In this video, you'll hear from Jess, Director of Business Development of Aftercare and Alumni Services at Sandstone Care, as she explains the discharge process and what it should be like as you're completing treatment. Hey, it's Clint with Sandstone Care, where we help teens, young adults, and their families overcome challenges with substance use, addiction, and mental health conditions. All right, let's get right to it.
Well, first I'll say that it's important to know that the more treatment a person can get, meaning the length of time they're in treatment, we know it's the higher likelihood that they'll stay sober. And so discharge planning looks a little different depending on what level of care or what kind of facility that they're coming from. But the goal is the same regardless, and that is that folks are set up with a comprehensive plan back in the world. So whether that looks like being connected with an individual therapist, a psychiatrist, a family therapist, or other community resources, or even just outpatient care at another treatment center, we want to make sure that it's really formulated for that person. It's not a one-size-fits-all approach. We really want to make sure that people have all of the tools in their toolbox when they're leaving treatment, because treatment's not like you go to treatment and then everything's fixed, right? And you go back to your life and everything's you got everything you need and you don't need anything else. And I think that sometimes can be daunting in the beginning to think, oh my gosh, after treatment there's more. But the hope is that if we do a really good job in discharge planning and getting people connected to the resources that address their specific needs, then it should be a seamless transition back into their community. So the hope is that services titrate down in number of hours. So if you're in treatment 20 hours a week or 40 hours a week, you're titrating down to maybe once or twice a week seeing a therapist or an outside provider. So our hope is to really find those providers that are going to be a good fit. And Sandstone does a really amazing job with discharge planning in that we really want to make sure it's not just plug in your zip code and plug in your insurance and spit out a list of people, but that we're actually providing resources to you and to your child that are people we know in the community. We know them, we have a relationship with them, they're vetted, so to speak, for quality, and therefore you can know that you're going to get the same level, if not better, care beyond Sandstone's doors as you had received while you were in treatment. So one of the things that I'm really passionate about is making sure that as part of our effort to ending the stigma of the need for mental health and people getting mental health services is to make sure they're getting to the right people. And the general public typically we're not all educated on all the different letters behind someone's names and what they specialize in. And a lot of times people go out to the internet and they're kind of chasing their tails trying to figure out, okay, who specializes in substance use disorder? Who specializes in trauma? Or they're just looking for any therapist, and maybe they'll get linked up with a therapist that doesn't specialize in the things that they're really focused on. And it can be a frustrating process when you're doing that on your own. Or if you end up with a therapist who does great work with you, but again, isn't somebody who specializes in your specific needs, then you may not be getting the most out of therapy that you could be. So what I'm really passionate about is being a matchmaker, so to speak, in that realm, and helping understand the full picture of what people's needs are, and kind of going into my Rolodex or my bag of resources and saying, okay, this is the perfect person based on what I know they specialize in and what your needs are, to ensure that you have a really great experience with providers in the community after treatment. And I think that it's just a daunting process if you don't have someone guiding you through that. And that's something Sandstone Care is really committed to.
If you want to learn more about treatment options for you, your teen, or young adult, then tell us about your situation on a confidential call using the number in the description below. Or live chat with us right now at sandstonecare.com. We'll connect you with the treatment that you need, and if we're not the right fit, we'll get you where you need to go. Be well, and remember that change is possible.